Two. Hello, my name is Steve. I'm going to be your nurse today, and I'd like to gather a little bit of information, if that's okay with you.
It is.
Okay. What brings you in to see us today?
I'm trying to find a new doctor.
Okay. Can you confirm for me, please, your name and birthday?
Jamie Finley, 5/2/1981.
Okay. And so you're here to just establish care, let's see. So tell me about your medical health. Do you have any medical issues that you're seeing for? Any concerns?
I have high cholesterol
Mm-hmm.
and GERD and depression.
Okay. Do you take medicine for these
I
things?
do.
Okay. So you've seen somebody for these things before. These have been diagnosed. Okay. You have any other medical concerns or issues or anything like that?
No.
Tell me about your childhood. Did you have any illnesses as a child?
I had chicken pox.
Chicken pox. Okay. And how old were you when you had chicken pox?
4.
4. Okay. What about any other concerns through your teenage years? Anything?
No.
Okay. As an adult, have you had any major illnesses or surgeries? Okay. You were able to avoid that whole COVID thing? All right. Very good. Congratulations on that. That's a big deal. What about immunizations? Are you up to date on your immunizations? Your childhood immunizations? As an adult, do you take the flu shot? Have you had the flu shot this year?
I have.
You're a little bit young, but have you had the pneumonia shot?
No.
Okay. As a child, did you receive the HPV vaccinations?
No.
Okay. Probably a little past the date for that. Let's see. Tell me, tell me about travel. Have you traveled outside the United States in the last year?
No. Unfortunately not.
No, unfortunately. Okay. Do you like to travel?
I do.
Okay. Have you had any surgeries in the past?
No.
You haven't had any joint surgeries or anything like that?
Nope.
Okay. No, you still have your appendix
I do.
and your tonsils? Okay, very good. So let's talk about your medications. Do you take any medicines?
I do.
What medicines do you take?
Rovastatin.
Okay, statin for high cholesterol. Okay. And what else?
10 milligrams.
10 milligrams. Okay.
Nexium.
Okay. Nexium, is that prescribed or over the counter?
Prescribed.
Okay. Do you know what the strength is on that?
40 milligrams.
Okay. And what do you take that for?
For GERD.
For GERD. How long have you been diagnosed with GERD?
Probably 8 years.
8 years. Have you ever had any follow-up with a specialist?
I have.
Have you had any upper or lower GIs where they stick a
I
camera?
have had
Okay.
both.
You've had both. And do you remember the results from that? Do they say anything? You indicate anything?
I have the beginning of Barrett's esophagus.
Barrett's esophagus. Okay, that's good to know. We need to get that taken care of. Have you had any complications since you started treatment? Any pain or discomfort? Any emergencies related to that? All right. So the statin, Nexium. Do you take any other medications?
Prozac. 40
Prozac?
milligrams.
How much?
40 milligrams.
40 milligrams of Prozac. And when did you start that?
Probably 15 years ago.
And the doctor prescribed that for what? What did you feel that you needed Prozac?
Depression.
Depression. What about anxiety?
Yes.
Do you have anxiety?
I do.
Do you take anything to control your anxiety? Okay. Does that seem to be working for you? Do you feel comfortable with that treatment? Does it help control your depression?
Yes.
Okay. All right. Very good. Are there any other medicines that you take? What about over the counter? Anything you buy at the pharmacy or the grocery store? You take
No.
any multivitamins or anything like that?
No.
Okay. That might be something that you look into. A multivitamin for a woman your age could be important for bone health moving forward. You're entering the premenopausal phase of your life, and your body's going to start changing very quickly, and we want to try to get ahead of that. you start having bone density issues. And
Take that into consideration. Thank you.
okay, very good. Are you allergic to any medicine?
I'm not allergic to anything.
Okay, nothing makes you sick, breaks out. What about food allergies? Are you allergic to any food?
No.
Have you ever had any blood transfusions
No.
in your lifetime?
Mm-mm.
Okay, very good. I see, we talked about you being on Prozac, and you state that you feel like that your emotional
Mm-hmm.
issues are well controlled.
Mm-hmm.
Do you feel any breakthrough issues periodically that you're uncomfortable with?
No.
Okay. Let's talk about, do you have any questions about any of that? Is there anything that I missed there?
No.
That you feel like I should probably be aware of? All right. Let's talk about your menstrual history. Do you still have a menstrual cycle?
I have an IUD, so I don't
you
have
okay,
regular
so you
periods.
have an IUD, so you do not have regular periods?
No.
Okay, when was the last time you had a period?
Before my IUD was placed.
And how long has that been? How long have you had your IUD?
I've had it replaced when I'm supposed to have it replaced, but I've had it for a total of 16 years.
16 years, wow. When was the last time you had it replaced?
3 years ago.
3 years ago? Okay, and do you follow up with your doctor related to that?
Mm-hmm.
Have you had any vaginal discharge?
No.
Any breakthrough bleeding? Any foul odors, smells, anything like that?
No.
Everything seems to be pretty good there?
Mm-hmm.
All right. How many times have you been pregnant in your entire life?
2.
2. And how many children did you give birth to?
2.
And at no point that you're aware of has your body ever aborted a baby, or have you had any elective abortions?
No.
Okay. Let's see here. Tell me about, have you begun to experience any hot flashes or unexpected moodiness?
No. Nope.
No?
Mm-mm.
Okay. I was just looking for night sweats, maybe, anything that would cause you to indicate that you're entering the menopausal phase of life?
No.
Okay, very good. Let's talk about a little bit about your personal or social life. Tell me about your diet. Do you feel like that you eat a balanced diet? What would be a normal day in the life of Jamie as far as diet goes? Do you eat a well-balanced meal with vegetables?
For the most part.
Okay, for the most part, all right. Have you had any recent weight gain, weight loss? Your weight's been pretty stable?
Yeah.
Okay. Tell me about exercise. How often do you exercise?
I don't exercise.
You don't exercise at all. Do you spend a lot of your time relaxing? Sitting around the house?
No, I do things. I do things.
Okay. Well, we try to tell everybody to go for a walk, get a little exercise, like 3 times a week.
That's something I should do. Is
Yes.
walk.
Yeah, walking is nice. It's kind of cold this time of year, but soon the weather will be nice, and you should go out and go for a brisk walk. Maybe do some sit-ups, push-ups, leg raises, something to get the old heart rate going. Okay. So tell me about alcohol consumption. Do you drink?
I do.
How often do you drink?
Maybe once a week.
Okay. How many drinks do you have in a week?
Maybe 4.
4 servings or 4 bottles?
4 servings.
4 servings, okay. Do you feel like that when you drink, most often you drink to the point of inebriation, or do you just drink socially?
Socially.
Okay, good. What about, recreational drugs? You know, I know the gummies are real popular these days.
No,
Or the vape pens. You smoke?
no, I don't.
You don't vape?
No.
Okay, good. Let's talk about your self-care. Do you check yourself for skin discolorations, moles,
Mhm.
freckles that are changing color? Do you examine your breasts,
Mm-hmm.
looking for lumps or firm places?
Mm-hmm.
When was the last time you had a mammogram?
Like 4 months ago, I think.
4 months ago?
Mhm.
And did they say anything
No.
that we should know about? All right. Are you sexually active?
Mhm.
Okay. Are you married?
I am.
Do you have more than one sexual partner?
Currently, no.
Currently? Okay. So there's some history there, some stuff in the past. We'll look into that later.
Circle back.
We'll circle back to that. But do you have any unusual pain or discomfort, physically or emotionally, when you have sex?
No.
Okay, good. Let's talk a little bit about your house, where you live. Where do you live? Do you live in an apartment, a house?
I live in a house.
Tent, what kind of house? And who lives in the house with you?
My husband and my son.
Your son, okay, so that's right, you have had children. You don't have any pets?
Jill.
Yes.
2 dogs.
2 dogs.
And a cat.
And a cat, okay, all right, very good, I love cats.
Mm-hmm.
Is it one story?
It's 1 story.
Okay, so there's no stairs, is it a concrete, or do you have to step up into it like a pier and beam house?
The pyramid house.
Okay, all right. Do you feel like that house is a safe place to be? Is it cool in the summer, warm in the winter?
Yes.
All right, very good. So what do you do for a living?
I'm a firefighter.
A firefighter. Oh wow, that's exciting. Thank you for your service.
You're welcome.
We couldn't make it without people like you. You first responders really carried us through the hard times.
Thank you. You're welcome.
How long have you been a firefighter?
25 years.
25 years. The fire service can set you up for exposures to lots of things physically and mentally. Have you had any CTs or MRIs to establish a baseline health status for you as you move forward?
No.
Okay, that might be something that we want to do. I know firefighters suffer from rare types of cancers that often go undetected for long periods of time, so we may schedule you for a CT just to establish some baseline readings.
I would be interested in that.
Okay, all right, very good. We also, it's a very stressful thing, so we may want to see about getting a stress test to make sure that your heart is good and that your circulatory system is good, just to make sure that you're safe as you move forward. At your age, the fire service can be very taxing.
That is true.
Well, my next question is about exposures to things at work, but as a firefighter, there's absolutely no telling what things you may or may not be exposed to. We also may want to get pulmonology on board to make sure that you don't have any asbestos in your lungs. But we'll get with the people up front, get these things scheduled to make sure that you're safe and that you're okay. Let's talk about your family history. Let's talk about your mom first. Does she have any medical issues, concerns? Is she still alive?
She is.
She is. And does she have, what kind of medical problems does she have?
She's diabetic.
She's diabetic, okay. Have you ever been tested for diabetes?
No.
Okay. Does she take medicine, like pills for it?
Mm-hmm.
Okay. All right, anything else? Does she have any mental issues, depression, psychosis, or anything?
Not diagnosed.
Not diagnosed. Okay, very good. Let's talk about your dad. Is he still alive?
No.
No. How long has he been passed?
Oh, for a long time.
I'm sorry to hear that. That's a very hard thing for a young lady to go through.
Mm-hmm.
If you don't mind me asking, what was his cause of death? What did he die from?
Esophageal cancer.
Esophageal cancer. Well, I'm sorry to hear that, but that could be important since you have Barrett's esophagus yourself.
Mm-hmm.
That's a doorway for esophageal issues and cancers, so we'll stay on top of that.
Okay.
And let's talk about your mother, your mother's mother.
Mm-hmm.
Do you know anything about her? Is she still alive?
No.
Okay. Does she have any medical conditions?
Asthma.
Asthma. And what about her mental health? Was she pretty
Nothing
okay?
diagnosed.
No depression?
Nothing
Again,
diagnosed.
nothing diagnosed. Okay. All right, very good. And what about your mother's father, your grandfather?
He had diabetes.
Diabetes. Had the diabetes.
Mm-hmm.
All right, so there's 2 generations ahead of you with diabetes, so we probably should check on that pretty regular, keep on top of that. And your father's mother, does she have any medical issues?
I don't know.
You don't know? Was she not a part of your life?
No.
So you never heard them talk about medical issues or mental behavioral issues or anything like that? All right. And your father's father,
Mm-hmm.
did he have any medical issues? Is he still alive?
No.
No, he's gone. Sorry for that. Did he have any medical concerns that you know of?
Esophageal varices.
Okay, again, we have esophageal issues. All right, that's something that's good to know, and we'll keep up with that. Stay on
Not
top.
from drinking. It was just.
Well, it doesn't always have to be from drinking. Sometimes people are just built that way.
Mm-hmm.
So let's go on to some other things. We'll talk about some of your bodily systems, starting at the top, going to the bottom. Do you have any concerns with your hair, your hairline? Do you lose your hair?
I do.
You do have
Yes.
hair loss,
Mhm.
like on your pillow, or like in the shower?
Yes.
Do you do the
All of the
the
above.
hair swirl on the shower wall?
Yes.
Yes, my wife does that quite a bit. All right, hair loss. And what about your nails? Your fingernails, toenails?
They're okay.
They're not thin, not really thick. You not notice like really thick toenails or foul odors or anything like that? Okay, all right, very good. That's good. And what about your skin? When was the last time that you went to a dermatologist?
It's been a couple of years.
In a couple of years. Have you ever been diagnosed with any skin cancer or abnormal moles or anything?
No.
Okay. If we get time, I may have you let me look at all your skin to check for these abnormalities. Have you ever suffered from headaches, like migraines, other than the normal? I see that you have children, so I know you have headaches.
And a husband.
And a husband. Which brings me to head injuries. Has you
No.
ever suffered a brain injury, traumatic brain injury?
No.
Anybody ever say anything to you about strokes or what we call TIAs or mini strokes, anything like that? Okay, that's good. And what about your eyes? Do you wear glasses?
Like cheaters.
Cheaters?
Mhm.
Cheaters.
LASIK surgery
You had
several years ago.
You had LASIK, okay. Well, not had LASIK, good heavens, girl, that's a medicine. You had LASIK surgery.
Yes.
All right. How long ago was that?
Probably 20 years ago.
And did you have any complications with that? Was it pretty good to you?
Mhm.
Successful?
Mm-hmm.
But now you have readers.
Mm-hmm.
Yeah, I have to wear them also. It's just a sign of the times, I guess. Have you ever had any facial trauma to your eyes, abrasions? You ever gone to the hospital or the emergency room for eye issues?
No.
Okay. Do you use eye drops?
No.
Eye drops, all right. Let's see here. Let's move to your ears. How's your hearing?
It's good.
Is it good? Is it pretty sharp? You feel good about that?
I feel good
I
about
feel
that.
like you hear most
Adequately.
everything going on. Okay. Have you ever had your hearing tested?
No.
No? Don't wear hearing aids?
Mm-mm.
All right. Do you ever have ringing in your ears? Hearing abnormal sounds? Do you have ear discharge?
No.
Nothing comes out of your ears? You get dizzy? Vertigo? When you stand up, move too quickly? Have you ever had an ear infection?
I haven't had an ear infection before either.
Okay. And left side, right side, both?
I've had both.
Both. And how long ago has that been?
10 years ago.
10 years ago? And are you still working to get that resolved, or is it cleared up?
No, it's cleared up.
Okay, not good. And what about that nose? Do you smell okay?
I do.
You having problems smelling? You feel like you smell everything? After COVID, a lot of people complain that they lost their sense of smell, but you feel like you smell all the smells around your house?
I think so.
Okay. You get nasal congestion or colds, sinus infections?
I do sometimes.
Sometimes, and what do you do when you have that?
You take allergy medicine.
Allergy
sinus
medicine? Okay, have you ever been treated for a nasal infection? Sinus infection?
Oh, yeah.
Okay. And when was the last time that?
Probably about a year ago.
Okay, about a year ago. Do you have post-nasal drip with your allergies?
Sometimes, yes.
And does that ever lead to like sore throats or tonsillitis? Have you ever had tonsillitis? Okay, when was the last time you had tonsillitis?
Probably about a year ago also.
Okay. Let's see, throat and mouth. Do you have any concerns for your mouth? Any sores in your mouth? Excessive salivation or dryness? Okay, and what about hoarseness? And I noticed that your voice is a little deep. Has it always been that way?
It's always.
Okay, all right. So, well, some people just have a naturally deep voice. Do you get a lot of sore throats?
No.
Yeah. You ever tonsillitis?
I've had it before, but not
Contusions
regularly.
from food or anything that would, okay? Any bleeding or swelling or edema in your gums? Your gums ever bleed?
No.
When you brush your teeth, do they bleed?
No.
Okay, good. Do you have any abscesses or sore places on your gums? Things that cause you concern? Any drainage from around your teeth? Have you ever had any teeth removed? No? So you have all your teeth, okay. And what about dental care? How many times a day do you brush your teeth?
Twice.
Twice a day, okay, very good. That's a good job. Has anybody ever said anything to you about your lymph nodes? Have you ever had tender places or sore places in your neck or under your arm, in your groin, behind your
My
knee?
neck.
Your neck? Neck? Can you point to where? Yeah, okay. And how long ago was that?
About a year ago when I had the tonsillitis.
Oh, okay, so it's associated with tonsillitis, okay. Did they do anything for it at that time?
Just whatever they treated the tonsillitis.
So it kind of resolved on its own, you've not had any pain or discomfort associated with that? All right. Any questions about your head and neck? Anything that I didn't ask that you feel like that maybe we should discuss?
No.
All right. Let's move to your chest and lungs. Tell me about your breathing. Do you feel comfortable when you breathe? Do you feel like you feel short of breath? Abnormally short of breath? Like when you walk in the grocery store, at the house? Do you have any pain when you breathe?
No.
When you breathe in real big, breathe out? Okay. Do you you ever notice if your lips or nose are a different color than they normally are? And when you rest, it gets better?
No.
Okay. What about coughing? Do you cough a lot in the mornings or in the evenings or when you exercise?
No.
Okay. What about wheezing? You feel like that sometimes you can get air in, but you can't get it out?
No.
Okay. Sputum. Do you cough anything up ever?
Only when I've been sick.
When you've been sick?
Mm-hmm.
Okay, but on day in and day out basis, you don't really
No.
have what we call a productive cough?
No.
Okay, good. Do you ever cough up any blood or when you cough stuff up when you're sick, does it have any blood in it? Is it any blood speckles?
No.
What about the night sweats? Do you have night sweats or get abnormally hot at night? Have to uncover or wake up and you're just
No.
wet?
No.
Okay. Have you ever been tested for tuberculosis? I'm sure as a firefighter,
Yes, I
you
have.
may be exposed to that from
I
time to
have
time.
been tested. Oh, bless you.
Excuse me.
Are you okay?
I'll have to see my doctor. It's just the tuberculosis discussion makes it act up.
Oh.
Do you know if you've ever been exposed to tuberculosis?
Not that I'm aware
Have
of.
you ever had any positive tests for tuberculosis?
No.
Okay. Do you know when your last chest x-ray might have been?
A year ago I was sick.
Okay, so you must have been really sick a year ago. Okay.
It's a doozy.
All right. Let's talk about your breasts. Do you have any swelling, changes in size or shape that is unexpected?
No.
Any pain? Do you have any discharge from your nipples? Did you breastfeed your children?
Yes.
Okay, and your milk has dried, so you
Yes.
don't have any discharge from nipples.
No.
Okay. Do you have any lumps that you're concerned about, or that perhaps we need to look at?
No.
Okay. When was the last time that you had? See, I asked you earlier about your mammogram screening. How long ago was?
A few months ago.
A few months ago. That's right, and everything was fine.
Mm-hmm.
Okay. So that. Let's talk about your heart, the circulatory system.
Mm-hmm.
Do you ever have any chest tightness, pain, or discomfort when you move or exercise?
No.
You ever woke up with having any chest tightness?
No.
Okay. Do you know when your last 12 lead was?
I think maybe 2 months ago, I follow-up visit.
After you were sick? Okay. Do you ever feel like that you have a fluttering? Do you feel like that you can feel your heart beating?
No.
No? Okay. And there's no dyspnea, no shortness of breath when you move about, when you're doing things, abnormal shortness of breath? Do you have any swelling in your lower legs? There's no edema at the end of the day where you got to prop your feet up and rest? Okay. What about high blood pressure? Have you ever been diagnosed with high blood pressure? Okay. You said that you don't exercise much, but when you do exercise, say when you're at work, are you able to work for a reasonable amount of time before stopping?
Yes.
So you feel like that you don't have any shortcomings when it comes to exercise?
No.
All right. So do you ever have any bruising on your arms, your legs that you can't explain?
Sometimes.
Sometimes?
Mm-hmm.
How often does this happen?
It's every now and then.
Is it pretty small, localized places, or is it usually large areas?
Small localized places.
Okay. Where do you see that most often?
On my arms or my legs, upper legs.
Okay. You ever see it on your chest, your face, your back, anything like that?
No.
Okay. Have you ever been diagnosed with anemia? Or any blood cell issues like sickle cell?
No.
Any blood-related diseases or issues
No.
you've ever been told about? Okay. We may want to get some blood work and verify those things. I trust you, but I want to verify that we don't have any concerns. Okay. Let's talk about your GI system. How would you say that your appetite is? Do you have
It's pretty healthy.
pretty healthy appetite?
Healthy.
Okay, that's good. What about, is there any food that upsets your stomach? I know that you said that you take Nexium and that you have GERD. Is there any foods that you have to avoid?
Things that are real greasy or like tomatoes.
Greasy tomatoes. Okay,
Excuse me, acid reflux.
okay. So you have heartburn quite a bit?
Yes.
What about nausea and vomiting? Do you ever
Yes.
experience that? And what do you do for that? Just hold on tight.
Yeah, really.
Okay.
Not a lot.
Well, if you
It's
have
generally
this,
associated with the heartburn.
okay, so maybe we need to drill down on your heartburn treatment and or the foods that are maybe causing this to avoid that. I know that you said that you drink socially. Maybe we should look into whether that sets off a chain reaction that leads to this nausea and vomiting, or maybe perhaps the amount of food that you eat could contribute to this. Maybe we need to break it down into smaller meals that are a little more soothing. Do you ever vomit anything that's dark or red? Looks like coffee grounds?
No.
All right, very good. Let's talk about your bowel movements. How many times a day do you have a bowel movement?
A couple of times.
Okay, a couple times a day. And is it hard or soft?
Soft.
Soft. And what color is it?
Just brown.
Brown. Okay, so it's not black,
No.
dark. Is it white?
No.
Has it ever been white?
No.
Okay, very good. So what do you like to eat?
A lot of things.
A lot of things. So maybe let's back up. Is there anything that you don't like to eat?
Carrots.
Carrots. We're out on carrots. So carrots cause you heartburn?
I
or
just don't like them.
You just don't like them? Cooked or raw?
Nope, either.
Just across the board. Is there anything else that you don't like to eat?
No.
Do you have any dietary restrictions? I know you don't like carrots, but that doesn't mean that you're allergic to them.
No. I
Or
don't
that
have
they
any.
cause problems. That's just an elective choice.
Correct. No, I don't have any.
So there's nothing that you have to avoid. What about vitamins? I think we mentioned vitamins already. Do you take any other supplements, protein, probiotics, anything else over the counter? Okay. Caffeine. Do you take caffeine?
I drink coffee.
Coffee. Wow. You know that could really
That's what
mess
acid
with your
reflux.
acid reflux. How often do you drink coffee?
Every day.
Yeah. What about those energy drinks?
Sometimes.
Sometimes, okay. Do you ever notice an association between those and your
I do.
stomach discomfort?
I do.
So that
I should do better there.
caffeine makes it better or worse?
I should do better and not have those things.
Okay,
Yeah.
okay. Well, you know, life happens. Sometimes we need a little something to get us going. But I would be very careful and avoid those after lunchtime, so that when you lay down, you don't have that.
You don't have a problem going to sleep.
Well, I was more concerned about when you lay
Oh,
down
yes.
and you have the reflux, and I would predict that you probably have to dash to the bathroom to resolve issues that could be caused by the choices that you make. And we want to try to limit and avoid those as much as possible. Make good choices for ourselves.
That's true. Thank you for that.
Let's talk about It's really cold out today.
It is.
How do you tolerate the cold? Now there is cold discomfort. Cold is cold, but some people really can't handle the cold. It causes them discomfort. And heat also, your ability to tolerate the heat. Have you ever had those problems related to heat or cold, or just don't like it?
Just don't like it.
Just don't like it. Me either. I mentioned this once before already. Have you had any unexpected weight gain or weight losses?
No.
You've always been this size for a while?
Mm-hmm.
Okay, good. You have a family history of the diabetes.
Mm-hmm.
Do you ever find yourself excessively thirsty? Or feel like that you urinate an abnormal amount?
Maybe.
Frequency?
Maybe not.
Maybe, okay. And do you ever find yourself constantly hungry, like you just can't get enough to eat?
Mm-hmm.
Okay. Well, those are what we call the 3 Ps,
Mm-hmm.
and those are predictive of a blood sugar issue. And you have family history of diabetes, so maybe we need to start tracking your blood sugar to see if that maybe is related to some of this hunger and urination. And it can also lead to nausea and vomiting as your body's not able to process and manage blood sugars. So maybe I should see if I get you a glucometer and maybe just once a day keep up with where your blood sugar's at.
Okay.
So let's talk about bodily hair. Do you feel like that you have an excessive amount of bodily hair, or has it changed? Have you noticed a beard or a mustache, facial hair, hair change on your legs or on your tummy? Anything that's changed from when you were younger?
No.
Okay, good. Have you noticed any skin discolorations, like around your neck, where your clothes touch you, around your arms, your waistband? Okay, those, if you do, let us know, because that could be indicative of some other concerns that we have.
Okay.
Let's talk about, I'm gonna ask you some questions. Is it ever difficult for you to urinate? No? It free flows, there's no burning, no foul odor, no discharge that you know of?
No.
Do you ever have flank pain, which means around the side or the back, kind of close to where your kidneys, well, you're a firefighter, you know about these things, where your kidneys are and it radiates around to the front?
No.
You ever been diagnosed with kidney stones?
No.
You ever had a kidney stone? Do you have any pain along your belt line, just under your belly button, that seems to be associated with when you have to urinate?
No.
Okay. Do you ever feel like that you have to suddenly urinate?
Yes.
Okay, so you have a sudden need. Is this because you put off urinating, or does it just like hit you like a bolt of lightning and just suddenly, my gosh, I have to urinate?
No. Suddenly
Okay.
it was after.
Okay, all right, well, that's something we need to keep an eye on. Do you ever wake up with that sensation at night? Or are you ever asleep and then suddenly you realize, my gosh,
Yes.
I have to urinate? Okay. All right. Do you ever have any blood or pink tinge? Does it ever look like fruit punch when you pee?
No.
Okay. How often, how frequently? In other words, do you pee once an hour, every 30 minutes, twice a day? How often do you feel like that you urinate?
Every couple hours.
Every couple of hours? And do you feel like that it's a reasonable amount, or is it just a little?
A reasonable amount.
Okay. Is the urine ever dark colored, like tea or Coke?
No.
Or coffee? Okay. Do you ever have trouble? I see that you have a couple of children. One of the things that we worry about is in urinary incontinence. Do you ever urinate on yourself when you laugh, or when you cough,
Sometimes.
or when you lift things?
Sometimes.
Is it a gush, or do you just just like a little dribble?
Just a little bit.
Okay. We need to keep up with that. We may need to do some exercises that can help strengthen the muscles, and get everything back to the way it was before you had children, and try to avoid some problems there. Do you ever have any urinary hesitancy? In other words, you need to tinkle, but it just won't come.
No.
Okay. And then it says here, edema of the face.
Okay.
Do you ever?
I think I just come this way.
Do you? I don't know. I'm not sure about this questionnaire. If they're saying that you don't urinate enough that it makes your face swell. I'm not sure. I think you have a very lovely face.
Thank you.
I've always been partial to little moon-faced girls. Let's talk about your bones and joints. Do you have any stiff joints? Now, I'm not talking about in the morning if you've been up all night with your friends and things just hurt, but just on the day in and day out, do you wake up with any pain or discomfort?
No.
Do you feel like you have a normal range of motion? Having
Yes.
problems bending down, reaching up behind you, anything like that?
No.
Do any of your joints have any swelling or redness? I'm concerned about your diet. If your diet is high in protein, then you could get what we call as gout. It's very painful. Usually it shows up in the great toe of your foot. It's very painful, and I don't want you to have that. That's horrible. Do any of your joints ever feel warm to the touch? Any deformity? Do you feel like you have any knots on your elbows or ankles or knees or anything that just doesn't feel or look right to you?
No.
Okay, very good. Do you have any questions or anything else about your bones and joints or anything up to this point that reminded you that you feel like we should maybe discuss?
No.
So let's move on to a neurological evaluation. Do you ever lose consciousness or pass out unexpectedly?
No.
Have you ever had a seizure? Do you have seizures?
No.
Even in your youth, nobody's ever said anything about you having a seizure. Okay. What about weakness in your arms or your legs? You feel like things don't work like they should? Okay. Have you ever had any paralysis? Have you ever been paralyzed by anything?
No.
Do you have any abnormal sensations? Now, I'm not talking about like somebody's trying to get you or that something's wrong. I mean like tingling, numbness, anything like that?
No.
You feel like everything's normal there? Okay. What about memory issues? Do you think if I gave you a series of items or numbers to remember that we could come back to it and you would be able to give that information?
I think so.
Okay. I bet at your work you have to memorize a lot of things. So there really wouldn't be any reason for you to not remember things. Okay. What about coordination? Do you ever just lose coordination, fall down on the ground?
Nope. All good.
Are you sure?
Nope.
You seem to hesitate a little bit there.
Nope.
Have you ever
Pretty coordinated and graceful.
Very graceful. Okay, did you play sports or dance
Yeah.
or anything like that? You feel like you still have that same strength and agility?
For sure.
You've never been just walking and suddenly you're on the ground for no particular reason?
Nope. Never.
Okay, that's good. That's good. Those are concerns as you move into the latter stages of your life. These are the concerns that we have. I don't want you, I worry about your bone density. If you're not coordinated and you trip and fall and break a hip, then it just sets off a whole chain reaction of things. Anything neurologically that we didn't discuss that you feel like we should address?
I don't think so.
All right, so this is kind of an uncomfortable part of the exam, but let's talk about your psychiatric history. Okay, so you suffer from depression.
Mm-hmm.
Okay, and that's a known thing. And how long have you had depression? Is it?
Probably since my dad passed away when I was in the 7th grade.
Oh wow, so that's quite a while. All right, I'll make a note here. Does it seem to be stable, getting worse, getting better? Does anything make it worse? I know
Just
that home
general
life
stressors.
sometimes can,
Or at work.
yeah, at work, yeah. What about mood changes? Or would you say that you're a moody person?
Probably, yeah.
Oh, okay. Didn't see that coming. So, how quickly does your mood change? Is it related to things that happen in life, just what we would call life, or are you happy one minute and unexplainably sad or angry in the next moment?
No, I think it's related to events.
Okay. And how often does your mood change dramatically like that?
I wouldn't say very often.
Okay, good. What about concentration? Do you find it hard to focus
Yes.
on something, keep your mind tuned in? Have you ever been tested for ADHD or
No.
any of those other related issues?
My son has that.
Your son has that,
Mhm.
okay. But we don't know where it came from. He's the first one to have that.
I probably had some help with that.
Oh, so you feel like do we need to maybe test you, see if we
That
can
would be good.
treat you?
It probably would help a lot of issues.
All right, let me make a little note here. ADHD rule out. All right. People with that concern in life also suffer from anxiety quite often. Do you suffer from anxiety?
I do.
Is it something that you feel like maybe overwhelms you or
Yes.
changes the way you process the world around you? Does it interfere with life?
Yes.
Okay. Would you think that maybe we need to talk to the doctor about maybe seeing if we can adjust your medications a little bit?
That probably
help
would
you
be helpful.
help you process the world around you a little smoother, a little easier?
That would be helpful.
Okay, that sounds good. What about agitation? Do you ever find yourself agitated or angry or aggressive, unexpectedly or unpredictably, abnormally aggressive towards other things or people?
No?
No, you feel pretty good about that?
Yeah.
Okay. What about suicidal thoughts? Have you ever had any ideas that maybe the world would be better if you weren't here?
No.
Okay. Have you ever been seen or treated for suicidal thoughts? Okay. And what about sleep? Do you have trouble?
I like to do that.
So,
I like to
okay,
sleep.
so you don't have any trouble sleeping.
No.
Do you feel like, or has anybody ever said that you sleep too much? That
Yes.
you can't stay awake?
Yes.
Okay. Do you do anything about it? What do you do once that's identified? How do you adjust to change that?
I try to stay awake. It just doesn't
It just doesn't happen. Have you ever been diagnosed with narcolepsy?
happen. No.
Have you been tested for narcolepsy?
No.
Okay. You ever fallen asleep driving a car
No.
or having a conversation?
I have,
Or
honestly, having a conversation.
okay. Well, maybe this is something that we should keep up with.
Okay.
Check on. Do anything else about your psychiatric well-being, your mental health, behavioral health that we haven't discussed that you've thought about? Maybe friends around you have identified that may be a concern?
No.
Okay. Can you get around your house okay?
Mhm.
Do you have any, do you use any crutches or walkers?
No.
Anything to help stabilize you, like in the shower or getting it up and down or in and out of the bed?
No.
Okay. And we've discussed your medicine, your statin for your cholesterol, your Nexium for your GERD, and your Prozac for your mental health. And you said that you don't take anything else over the counter. What about Tylenol, ibuprofen?
Just if I have a minor ache or
Just
pain.
as you need it. But there's nothing that you buy and take on the regular over the counter. What about herbal stuff? Do you take any herbs or anything like that? All right. Is there anything else that you feel like that I haven't touched on that you, as a provider, that you feel like that I need to know? Do you
Pretty
have
thorough.
Do you have any questions for me? Is there anything that you would like to ask me? Okay. Well, I thank you for allowing me the opportunity to meet you. Get to know you a little bit better, and I think we've identified a few things here that we can investigate or maybe look into improving for you in your life. Now that I have this, I will get it charted and documented, and the doctor will be in to see you in a moment.
Thank you.
Thank you for your time.
Thank you.